Good morning. It's February 11th, and this is your daily brief in science. Here's everything you need to know. A new Lancet analysis pooling UK Biobank and Finnish data with more than 540,000 participants finds obesity linked to about a 70% higher risk of hospitalization or death from infectious diseases such as COVID-19, flu, and pneumonia, with severe obesity carrying even higher risk. The authors urge cautious interpretation of global estimates and call for policies that support weight management, including affordable healthy food access and opportunities for physical activity. Possible mechanisms include impaired immune defense, a nutrient-rich milieu that may aid pathogen survival, insulin resistance, hyperglycemia, and chronic low-grade inflammation, though exact causes remain uncertain. Co-author Dr. Sarah Ahmadi Abhari of Imperial College London stresses careful interpretation of global estimates. Experts not involved in the study, such as Aubrey Gordon and Samuel Klein, corroborate the findings and discuss implications for clinical practice and public health. Associate Professor Leslie Gray highlights accessible vaccination, timely care, inclusive health care, reduced weight stigma, and cautions against simplistic messaging that focuses only on adiposity reduction. The piece notes readers can access the article via the newspaper's subscription and references the printed edition date of February 10, 2026, with additional details on the PUBLICO site. Professor Wayne Cutfield notes that association studies cannot prove causation, mentions a dose-response pattern, and discusses potential implications for obesity treatments and policy in New Zealand, including Wegovy, semaglutide. Biological explanations include impaired lung function, metabolic and hormonal factors, and chronic inflammation that may dampen immune responses and antibody quality. The study shows association rather than causation, calling for more global data and preventive measures such as vaccination and improved access to diet and physical activity. Dr. Monica Sharma explains mechanisms linking obesity to increased infection severity and advocates viewing obesity as a chronic metabolic disorder requiring comprehensive treatment. A long-term randomized trial suggests that adults who underwent speed training and completed booster sessions had about a 25% lower risk of dementia by the end of the study, indicating sustained processing speed training may affect dementia risk. The active trial followed more than 2,800 dementia-free adults with an average age in the mid-70s across 6 U.S. communities to compare 3 cognitive training approaches against no training. Findings were published in Alzheimer's and Dementia, Translational Research and Clinical Interventions, with authors urging cautious interpretation and more research to confirm results. Independent experts note the results provide valuable long-term data, but should be interpreted cautiously due to limitations, including reliance on health record diagnoses and the exclusion of some participants with impairments. The study involved institutions like Johns Hopkins, University of Pennsylvania, and University of Washington, highlighting collaboration across top centers, and NIH funding supported the work. Posit Science researchers expressed optimism about the findings and potential public health implications if validated, while experts caution that dementia diagnoses were drawn from health records rather than clinical testing. Double Decision is presented as a low-cost, evidence-backed tool within a broader dementia prevention context, though replication is needed. The article also cautions against broad claims about consumer brain training products and recommends medical advice for individual health decisions. Experts highlight the causal inference from the randomized design and the potential to scale adaptive online training to amplify benefits. Initial results were reported by Lynn Pindries and colleagues in the cited journal. A new transparent review process for vaccine safety and effectiveness is being rolled out for the 2026-27 respiratory season, focusing on influenza, COVID-19, and RSV. The Vaccine Integrity Project, in partnership with the American Medical Association, will conduct an evidence-based evaluation and share findings openly to guide clinical decisions. This AMA-led effort runs alongside ongoing collaboration with CIDRAP at the University of Minnesota to continuously assess safety and effectiveness. This marks a broader shift among major medical societies toward publicly questioning federal vaccine policy, following earlier moves by groups like the American Academy of Pediatrics that diverged from CDC recommendations. Participating societies will use the review briefs to develop population-specific guidance for groups such as pregnant women, children, older adults, immunocompromised individuals, and healthy adults. The briefs will be circulated to member societies to inform targeted decision-making across patient populations. The initiative aims to restore trust in an evidence-based, transparent process for vaccine recommendations amid concerns about the perceived weakening of the CDC's ACIP-driven system. By maintaining continuous evaluation and open methods, the effort seeks to rebuild clinician and public confidence in vaccine guidance. The move follows a CDC ACIP decision to alter infant vaccine recommendations, prompting the American Medical Association to pursue its own independent review process. Key components include structured policy question development, ongoing expert panels and monthly scientific meetings, systematic literature reviews, and open data transparency with an independent verification protocol. Building on the 2025-2026 review, the program aims to create a durable framework for evaluating respiratory virus vaccines with input from medical societies, public health, and healthcare organizations. The Vaccine Integrity Project, launched in April 2025, has already completed the 2025-2026 review and is evaluating the birth dose of hepatitis B and HPV data with ongoing influenza, COVID-19, and RSV assessments. A new study links mechanical compression from brain tumors to neuron death and cognitive decline, suggesting a targetable mechanobiology pathway for therapy. Researchers at Notre Dame used human neural networks derived from induced pluripotent stem cells and applied artificial pressure to mimic tumor-induced compression, observing neuron and glial cell loss and reduced synaptic activity. They paired this in vitro model with a live compression system on preclinical brain models to validate the connection between mechanical stress, neuronal loss, and inflammation. The work, published in the Proceedings of the National Academy of Sciences on January 2, 2026, also points to glial neuroinflammation as a component of the response to compression. Clinical data from the Ivy Glioblastoma Atlas project show glioblastoma patients exhibit similar gene expression changes and cognitive and motor impairments, aligning with the experimental results. The gene expression patterns seen in the model parallel those in patient data, supporting the relevance of tumor-induced compression to human disease and its links to cognitive deficits, motor issues, and seizure risk. Funding for the project came from the National Institutes of Health and Harper Cancer Research Institute, with additional support from Notre Dame centers and facilities. The study was led by Meenal Datta and Christopher Patsky, who integrated engineering and neuroscience to model mechanical stress on human neural networks derived from iPSCs. Overall, the findings indicate that targeting identified mechanobiology signaling pathways could offer therapeutic strategies to prevent indirect neuron death caused by mechanical compression, with potential applicability to other brain injuries involving mechanical forces. Quantum technologies rely on quantum phenomena like superposition and entanglement to build computers, sensors, and communication networks that can outperform classical systems in specific tasks. In medicine and materials science, quantum computing could accelerate drug discovery and enable simulations of complex molecules and materials, potentially shortening timelines for treatments and enabling advanced energy materials. Quantum computing could transform optimization problems in logistics and finance by exploring many solutions in parallel, enabling real-time route optimization, better energy grid management, and more robust portfolio analysis. Industry observers anticipate a roughly 10-year horizon for commercially viable quantum technologies, spurred by strong global investment in advancing prototypes beyond the lab, with policy, education, and workforce readiness becoming pressing needs. Artificial intelligence could be significantly accelerated by quantum computing, enabling faster training, larger-scale data processing, and more capable models for diagnostics, data integration, and scientific research. Ultra-secure communication stands to be transformed by quantum key distribution and other quantum-safe methods, strengthening encryption and privacy across financial, health, government, and military networks, while prompting cybersecurity considerations for existing systems. Quantum sensors promise ultra-precise measurements for navigation without GPS advanced medical imaging, and environmental monitoring, improving detection of geological shifts and pollutants. The field is moving from theory to practice, with IBM unveiling 2 new quantum supercomputers and Denmark pursuing the world's most powerful commercial quantum computer, signaling rapid progress toward real-world applications. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.